Hi, everyone. Thank you for attending this webinar on depression presented by Breakbod.com. I'm very pleased to be here with you today or this evening. My name is Marcy Starkman. I'm a licensed psychiatric clinical nurse specialist. My talk is going to be based on my clinical experience, my clinical knowledge, but in no way is it to be taken as a substitute for medical or professional advice. I'm going to present for about 20 minutes. During this time, while I'm talking, all your mics will be muted in order to minimize any audio interference. But at the end of my talk, I'll open up the mics and invite your questions and comments. Please don't be shy. We need your help and input to get this information out there. And there's no question that's too dumb or too silly, so please feel free to ask away. Let's go ahead and get started. There's many different kinds of depressive disorders that are officially diagnosed, as you can see here. Some of them make sense right away when you look at them. Other ones you think, what is that? Major depressive disorder, I'm going to talk about a little more in a few minutes. A persistent depressive disorder is called dysthymia. And a person who is chronically unhappy, we say that they are dysthymic, or that they may have persistent depressive disorder. For example, my grandmother, from the time she was 40 years old, kept saying, God should only take me. I had enough. I'm done. Well, she was like that until she passed away at about 96. There was nothing good in her life. You may hear these kinds of people described as negative Nellies. There's also premenstrual dysphoric disorder, PMDD, which can be called PMS. It used to be called PMS, now it's called premenstrual dysphoric disorder. Only strikes women, of course. Substance and medication-induced depressive disorder, which can be brought about by drug abuse, or sometimes people get depressed from the actual medications that they take from other things. So if someone's taking, let's say, a blood pressure medication, one of the side effects from the blood pressure medication may be that they become depressed. So that's something that has to be assessed. Not every blood pressure medication does that to every person. It's very individualized, but it is something to keep in mind. Also, some people become depressed because of physical issues that are going on with them. Like, for example, certain kinds of cancer. People manifest depression first. Parkinson's. Again, not all the time, not everyone, but these are all things that if a person has depression, they really need to have checked out professionally. And that's what I mean by a depressive disorder due to another medical condition. How do people get depressed? Well, it's not just waking up in the morning and saying, I feel depressed. It is a biochemical process, and I put this diagram on to kind of give you an idea. It's in the brain. There are certain chemicals in the brain called neurotransmitters. When a person has a deficiency of these neurotransmitters, be they serotonin, norepinephrine, or dopamine, they can develop a biochemical depression. It used to be that they would say that there were two kinds of depression. There was a reactive depression, which is someone becoming very sad because, let's say, their dog died. But then they would say that's one kind, but another kind might be an endogenous depression, which meant that the person just felt very bad and sad and hopeless and didn't know why. Now there's no distinguishing between the two. They are not labeled separately because we found that each thing can affect the person's biochemistry in their brain. So that if your dog does die and you have a hard time getting over it, you may develop decreased neurotransmitters, which would cause you to have a biochemical depression. Same thing, if you have a biochemical depression, you might react much stronger to some event that's happening in your life or in the world as a result of the fact of having a shortage of these neurotransmitters. So the one on the left is normal. Those are two nerve cells, and that's how the neurotransmitters go back and forth. In the middle, with depression, you can see that there are less neurotransmitters. And on the right, with treatment, when someone takes antidepressant medication, the number of neurotransmitters that's available to the body increase, and that's what's going to help the person feel less depressed. So that's a pretty quick and easy definition of how depression works. The point of antidepressant medication is to increase the amount of neurotransmitters available to the brain. That being said, I'm not going to talk in great detail today about medications and antidepressants, but I will certainly be touching on that next week. So I just want to set the background so you understand how this happens. I'd like to show you what we call a PET scan. PET scans are a relatively new technology. They show how the brain is working. It's radiation. A person is given an IV substance for the test, and then they're told to wait for a while, and then a little while longer, an actual X-ray is taken, a special X-ray, as you can see this. It's computerized, it's kind of like an MRI or a CAT scan, a little bit different. But you can tell on the left that a person who is depressed, their PET scan comes out without a lot of activity in their brain, and that's because they're lacking in neurotransmitters. On the right-hand side is a quote-unquote normal person who does not have depression, and you can see how lit up their brain is, how much activity is going on. Now, one thing to think of with this too is if I had another picture, which I will probably show you next week, is that a person who has mania, their brain would be even more lit up than the one of not depressed. And I don't mean their brain is lit up, I mean that the radiation is able to track areas of increased activity in the brain. So the one on the right is what we're aiming for when someone takes an antidepressant medication. Let's talk for a bit about a major depressive episode, because this is what we tend to see in people. This is the general classification of people that are suffering with depression. They need to have, for someone to have a diagnosis of depression, they need to have at least 5 of these criteria, okay? 5 criteria, there's 9 of them. They have to have 5 out of the 9 for at least 2 weeks. Okay, so let's just run down. Depressed mood, that can either be the person themselves feels depressed, or they see, or that you see that they look depressed, or that they're tearful. A change in sleep. They can have something called, they can have either insomnia, which is an inability to sleep. They can have something called early morning awakening, where they get up at 3, 4 o'clock in the morning, can't fall back asleep again. Or they have the fact that they just can't fall asleep at all. Could be the other way. They can have something called hypersomnia. Hyper, anything is too much of something. Someone with depression, with a major depressive episode, might have hypersomnia. So they're sleeping all the time. Now, part of that might be because they just want to escape the world and how they're feeling, but biochemically, it can cause hypersomnia. And appetite works the same way, by the way. When we get to the bottom where it says appetite disturbance or weight loss, it would be 5% of the person's weight, but appetite disturbance can be either eating everything in sight, binging on carbs, or no appetite whatsoever. So that's another criteria, either too much or too little. Someone might not be very interested in things that used to bring them pleasure. And that the technical name for that, the official name for that is anhedonia. So we say that the person is anhedonic. And you know this person. They used to love to go to the movies, and you try to get them to go to the movies and say, come on, let's go have dinner and go see a movie. No, I don't feel like it. No, oh, I don't want to. No, you go without me. If there's consistent decreased interest in usual activities, then we say the person is anhedonic. They may feel guilty or worthless. I'm no good. The world would be better off without me. Everything is my fault. Very poor self-esteem. Decreased energy or fatigue. Trouble concentrating. They can't sit and watch television for a long period of time. They'll say to you maybe, I used to love to read. Now I can't even read. I'm not into reading. I used to do crossword puzzles. I can't do them anymore. We'd say that those are some things involved with concentration difficulties. Psychomotor retardation or agitation. Psychomotor, if you break that word down, it means it's the body. It's not that the person is developmentally delayed or anything. It just means that they move like they're in slow motion. Psychomotorly walking, they're very slow. They might shuffle their feet. They may not feel like getting out of bed. Everything is an effort. It takes them 15 minutes to brush their teeth. That's what we would call psychomotor retardation. Or it can be the other way around. They're very agitated. They're wringing their hands. They can't sit still. They're up and down. They're in and out of different rooms. And then finally, suicidal thoughts, which I will talk about later. So those are again, we need to see 5 out of the 9, and people can do a bit of self-screening to say, you know, hey, this is what I have, this, and this. And if there are 5 things and they've been going on for more than 2 weeks, then perhaps it's time to go get checked out, because the earlier depression is, the earlier there's intervention, the earlier the person gets better. If you can nip a depression in the bud, it's so much the better. And I also want to mention about the agitation. A lot of people, when they're anxious, get agitated. They can't sit still. They wring their hands. They're very nervous. They jump easily. There's something to remember that depression and anxiety usually occur together 75% of the time. So that being said, a lot of times someone who is depressed becomes anxious. I'd say that they're like kissing cousins. They're depressed, they become anxious. And the more anxious they get, the more depressed they get. And the more depressed they get, the more anxious they get. And it's a bit of a vicious cycle. So also keep in mind, when you do see agitation and depression, there may be a fair amount of anxiety as well, because they do go together. Depression is an illness and not a choice. Believe me, no one would choose to feel like this. Sometimes you get very impatient with a depressed person, and you want to say to them, just snap out of it. You know, don't feel sorry for yourself. There's a lot of people in the world who have it a lot worse than you do. Or if you just get over it and, you know, stop this crap or whatever it is an illness. It's just as serious as a medical illness. A person can die from a depression no differently than they can die from a heart attack. And also there is now lots of studies that correlate chronic depression with more chronic physical illnesses. So it's definitely an illness. No one would choose to feel like this. It's like feeling at the bottom of the barrel. If they could feel better or make themselves feel better, they would. So when you want to communicate with a depressed person, one of the first things to know is don't ask them why they're depressed, because they may not be able to give you a good answer. They may be feeling depressed and not even know why, because it's biochemical. It's affecting their whole outlook. It's like having dark gray sunglasses on the world all the time. They don't know why they feel that way, but they do. Another thing that happens when people are depressed is that they let things clutter up. They have all the dirty dishes in the sink. They don't pay attention to their mail. They leave all their clothes wherever they happen to take them off. So one thing that you can do to help them is to volunteer to help them with some of this clutter, because when they look at clutter, clutter feels overwhelming. And when someone is depressed, they already feel overwhelmed. So we want to do what we can to help them with clutter. Fix them a good meal. Sometimes they don't have the energy to do that for themselves. Get them outside and moving. You've heard about endorphins. Endorphins are good hormones. We want to get the person getting some of those endorphins moving. That will also help with the depression. Ask them to help you understand what they're feeling. Sometimes they say, well, you don't know how I feel. You don't know what I'm going through. Be patient with them. Ask them to help you understand. Get them to focus on self-care. Get them to take a bath if they're not willing to do that. Help them, maybe help them get their clothes out. Help them get dressed. Say, look, you don't have to put everything on today. Why don't you just change your top? Break every big task down, which seems overwhelming, to a very small one. Reassure them that you are capable of handling their feelings, that whatever they have to say to you, you can handle it. And when they're negative and they say, you know, I'm worthless, I'm no good, don't argue with them, but try and point out to them in ways that, in fact, they're a very good person and how much they mean to you and how important they are in your life. Now, when you're the depressed person, it's a little bit different. You want to explain exactly what you're feeling or not feeling. Like if you had a bad day at work and you come home and yell at your significant other, you want to say, if it's because of depression, you want to say to the significant other, it's not you. It's something that happened at work today. I'm sorry. I'm feeling a little down. Because if you don't explain how you feel, the other person thinks that it was something that they did or said. Be prepared for questions about the depression and have information available. The more you learn, the smarter you are about the illness, the more, first of all, you're going to be able to cope with it, but the more you're going to be able to help someone else. Be reassuring that this is very common and manageable, that lots of people get depressed, but people do get better. Sometimes all it takes is the right medication or the right treatment, and they will feel better. Explain to whoever's there for you what they can do to help you. Don't push people away. You know, our first instinct when we feel bad is to kind of want to go into our little shell and push people away because we don't think that we're fit to be with. But it doesn't help to do that. We have to let people in. Maybe have them go to therapy with you if you go to therapy. And most of all, don't expect other people to be your therapist. They do not have the same level of patience and understanding and professional knowledge to help you in a way that you might need help. So don't expect them to be your therapist, but by the same token, if you're feeling really bad and you're thinking about hurting yourself, please don't hide it from the people in your life. Share it with them. They need to know they love you. They want to be there for you. Treatments. I'm going to buzz straight through these. Like I said, next week we're going to talk about medication more. Medications are very helpful, so is psychotherapy. Studies indicate that a combination of medications and psychotherapy are the most effective treatment for depression. So that's something important to remember. Support groups. There are more invasive, what I call invasive kinds of therapy like ECT, which used to be called shock treatments. Some people who have a very, very severe depression that has not responded to anything else, any other kind of medication or any other kind of treatment. ECT is often the treatment of last resort. But that's for people that are severely depressed and maybe at risk of hurting themselves. Phototherapy, especially up north. I live down here in Florida, so this is not much of an issue, but where it's cold, Alaska, Canada, New York, where the days are short and there's not a lot of sunshine in the wintertime, people develop seasonal affective disorder, and good treatment for them is light therapy. Diet, vitamins and minerals, herbs, acupuncture. Now the rest of them on that list are all still being researched. Some involve magnets, it says magnet. The other ones involve electrical impulses that are all of these. The magnet therapies are temporary, but the electrical, the vagus nerve, the deep brain are almost like an implantation into the brain with a pacemaker type device. So you can imagine when someone's feeling really depressed, whether they would want to go through all of that. But it is being researched as a treatment. They tend to work faster and have less side effects than medications do. And then finally, there's a new one on the horizon called ketamine. It was a hallucinogenic substance that they're finding now. If small amounts are given in a controlled way through an IV, that the person becomes less depressed within hours. And it only lasts for about a week and they have to have another treatment. But the things in red are all on the horizon. The other ones are being used as we speak. Self-care, I think number one, rule out physical causes first. Make sure that there's nothing physically wrong, and that would be a visit to your physician or your healthcare provider. As I said before, let people in, don't be afraid to ask for help. Try and establish regular sleep and meal times, even if you can't fall asleep. You should try and go to bed at the same time every night, wake up at the same time every morning, and the same thing for meals. Eat the same time every day. Limit negativity. I'm sure some of you, if you're like me, felt like you have to just turn the TV off sometimes lately. Sometimes you have to take a break from the news. Sometimes, even if you're not depressed and you hear the news day after day after day, you get depressed because some things on the news are very depressing. So if you limit, you can make a conscious decision to limit negativity. Exercise, share it. I say fake it till you make it. Even if you feel depressed, act like you're not depressed. Studies indicate that if you do this, sometimes when you act like you're not depressed, you actually do start feeling better. Learn and practice cognitive therapy techniques, which is a very effective way to deal with depression. If you there's three areas that it focuses on: a negative feeling about yourself, negative feeling about the future, and a negative feeling about the world. And if we can change the negative thinking, then we can change the negative behavior. And you can do some of that yourself. It helps to have a cognitive therapist as well. And don't stop taking the medication. That's like someone who takes antibiotics and after 2 days, they feel much better, so they don't take the rest of them. It's the same thing. If you feel better when you have depression, don't stop taking your medication. You need it until you get the okay from your healthcare professionals. Okay, I'm going to skip stigma for today. The important question, the reason people don't get help for depression is because they're afraid. Depression is listed as a mental illness. People don't want other people to see them as having a mental illness, and that's a whole nother issue that we can talk about some other time. I like this quote. This is one of my favorite quotes that I use with my depressed patient. The best way out is always through. In other words, they may talk about, oh, the world would be better off without me. Maybe if I just, took pills and went to sleep, never woke up, everything would be better. I wouldn't be in this pain anymore. And I heartily disagree. The best way out is always through. That's the best, is to go through what you're going through. There is a light at the end of the tunnel, and I think it's really important when you're depressed not to forget about that. But if you're concerned about someone being suicidal, please do not be afraid to ask them. You are not going to put the idea in their head. They already have it. You're just bringing the talk out in the open, and sometimes that's what needs to be done. And I have some resources here for you that we will leave up with the slides. They're all evidence-based. They're not just someone's opinion, but they're backed by scientific data and good information, and almost all of them direct you to how to get more support for yourself if you need it, how to sign up for a support group or how to find a support group in your area. So that's about it for me today. I would love to open this discussion up for questions. We're going to open up your mics. Please feel free. Anything you'd like to ask me about, I'm here for you. Take advantage of the resource, okay? Anybody have a question?
Yeah, Martha, I'm going to ask you a question. Marcy, sorry.
Okay, that's all right. Hi, Zelda, you're back. Hi.
Do you think that meditation and physical exercise helps in any way for folks that are depressed?
Absolutely, yes. I'm sorry if I cut you off. It was just such a positive answer. Yes. Were you done with your question? I'm sorry.
No, I was asking if meditation and physical exercise.
Yes, absolutely. The physical exercise, like I mentioned, it gets the endorphins going, which are a feel-good hormone. And meditation also helps the brain. It's all about, if it's biochemical, it's going to help anything that improves the biochemistry of the brain. It's going to help that person feel better. So yes.
Oh, okay.
Definitely.
Thank you.
Is depression, could it be hereditary?
Hereditary, oh, definitely, definitely. They're finding that it does run in families for sure. An interesting statistic is that 1 in 4 people have a mental illness. So that's like 25% of people. but it is genetic. I didn't go into a lot of talk today about bipolar, which is a whole nother, but any kind of depression can be genetic. I deal with new moms who have postpartum depression, and the first question I ask them is, anybody else in your family have depression? Also, depression and substance abuse may be tied together as well. So I would say yes. Go ahead.
No, I was just thinking that, let's say that in children,
Yes.
if something that's hereditary is something that they could detect early, with using the same criteria that we use with the adults.
That's an excellent point. Absolutely. And I didn't mention that, but I should have. They're now able to diagnose children as young as 3 years old with depression, using a lot of the same criteria. It's difficult, sometimes for a kid to say, I feel depressed. So we have to look at more of the objective evidence. Sometimes you might think that the kid is highly sensitive, and it certainly would warrant more of a close look by a healthcare professional for sure.
Okay, one last question. What about violent behavior? Do they exhibit any of that, people that are depressed?
That's a good question too. In terms of violent behavior, a person who has depression tends to be more violent towards themselves. They dislike themselves. They want to hurt themselves a whole lot more than they want to hurt anybody else, compared to, let's say, someone with schizophrenia who hears voices telling them to hurt other people. When someone is depressed, they want to take it out on themselves. Now, what you might see, and what's an early sign for someone who hasn't been this way before, is irritability. If someone has never been irritable before, but now they're very irritable and every little thing bugs them, and they have some of the other signs and symptoms, yes, I would say that they should be evaluated for depression. That's if you can get them to go.
Marcy,
Yes.
the major depression episode list that you outlined,
Yes.
that would not in any way be related to any other issues, medical issues?
You mean if they had 5 out of the 9 criteria?
Yes.
It very well could be, but as I said, sometimes a physical illness can show itself. The first sign is that they've got a biological depression because they've got 5 out of the 9 on that list. So the first thing to do is to perhaps have them, like for example, thyroid illness can sometimes mimic a clinical depression. And when the thyroid gets treated, then the depression abates, gets better, because the real problem that was causing the depression was the thyroid or a cancer or something like that, liver disease. I don't know, does that answer your question?
Yes, it does, yes.
Okay. It all has to be teased out.
I guess I was reading through your list of remedies.
Yes.
And I guess when you got the cognitive therapy, I think I kind of missed that. Could you say what that was again?
Sure. Cognitive therapy is one of the kinds of therapies that have been tested and scientifically evaluated. And the point of cognitive therapy, cognitive means thinking, right? So the reason that cognitive therapy works well on depressed people is because they have a negative view of themselves, they have a negative view of the world, and they have a negative view of the future. And part of that is their thinking. So what cognitive therapy does is to help them learn how to think differently. Like not to think positively, but to think differently, to like consider other possibilities. Like if someone's supposed to meet you for lunch and they don't, and you're a depressed person, right? And you think, oh, it's because I'm such a terrible person, and that's why they didn't meet me for lunch. But a cognitive therapist would teach you, well, maybe it was that, but maybe it was also they got a flat tire, they had a family emergency. Cognitive therapy helps you see things differently. And it's also shorter. It doesn't take as long. It's not, when someone's depressed, they don't need 5 to 10 years of psychoanalysis on a psychiatrist's couch. They want to feel better right away. There's a lot of homework with cognitive therapy, and people are trained to be cognitive therapists, and that's all they do. I use a lot of that in my book. How about anybody else have a question for me? Are there more?
Yeah, I have a question.
Okay.
You were saying that that if someone else has another medical condition, that might be why they're depressed. Or I don't remember exactly how you described. There's a relationship between having two I guess illnesses, one being depression, the other one being something else.
Right.
So if it is a situation in which a person has another or has a mental illness, let's say,
Yes.
and they're also depressed, how should I determine whether or not that other separate mental illness is a barrier, and that other mental illness might prevent this person from hearing what I'm trying to say? How could I determine that?
Well, I think you have to look at the symptoms that someone is displaying. You know, if someone is, let's say, we know that in schizophrenia, the person's hearing voices. And let's say that person's hearing voices that are telling them that all helpers are no good, all helpers are bad. But they're also got all of the signs and symptoms of depression. Both of the illnesses have to be treated because there be certain targets in the brain's biochemistry. Some are for schizophrenia, some are for depression. And some people take antidepressive medication and antipsychotic medication and get talking therapy, a combination. It's like, what symptoms is the person displaying, and we want to try and give them symptom relief. And if we help them with one thing, chances are we then can decide what else it will be to help them with the other. I don't know, does that answer your question?
Yeah, in one way, it does answer my question, because it tells me that there's certain things, there's certain behaviors that are out of my control. So really, the question that I would like to know the answer to is, how do I know when there are other problems that are out of my control? And if that is the case, do I just say nothing? Do I not even try to help this person?
Are you saying, like, let's say somebody had, let's say they had a liver tumor and they get diagnosed with the liver tumor and they are depressed as well?
Yeah, well, something a little bit more relevant for my life is
Sure.
someone had Alzheimer's, for instance,
Right.
and or some other neurological condition,
Mm-hmm.
and say they were losing cognitive abilities, and they were aware that they were losing their own cognitive abilities.
Right.
That would cause them to be that. Understandably, I could understand if they would be depressed as a result of that.
Yes.
So but there's no stopping Alzheimer's,
Yeah.
and so in that situation, really, what is it better? Do you think to try to pull them out of depression, even though it's ultimately not going to be effective? It ultimately is going to be useless, or do you just let them succumb?
Right. Well, I think it comes down to if, whether it's life-threatening or not. I mean, if the person is so clinically depressed, even though they have Alzheimer's, that they're not eating or they're not sleeping or they're trying to hurt themselves, and we know that they could have a bit of a better quality of life, even though they had Alzheimer's, yes, it would still help to treat the depression. Because someone can have an illness like Alzheimer's, but once biochemically they're depressed, it's hard to get them to do anything that would help the Alzheimer's. Hard to get them to maybe get moving or participate in activities or go to a treatment program or something like that. It's very complicated when it's, especially when it's more than one brain illness at a time. It has to be teased out and assessed.
Thank you very much.
You're welcome. Anybody else have any questions? You're awfully quiet. Do you think that people get better from depression? Have you seen people get better? I'll ask you a question.
I think I have seen people get happier, but you know, but it can be very fleeting. You know, maybe they're happier
Yes.
now, but they, you know, they lapse right back into the depression. So, you know, I guess everyone's different, right?
Definitely, definitely. And like I said, the real place where it gets mixed up is when somebody gets like an angry depression, like the way they manifest their depression is not from being withdrawn and inside of themselves, but where they're lashing out verbally at other people all the time and doing things that aren't good for them because they're angry. They're speeding off in the car, or they're throwing things in the kitchen, or they're still depressed, but they're manifesting it in a way that's harder to want to help them because what they're doing is pushing people away. Nothing else?
Yeah, hello?
Hi, go ahead.
Oh, okay. In a case whereby you are associated with someone who you find probably gets up every morning and come to work or, you know, place of business and says, well, whose life am I going to make miserable today? Could that be some sort of depression, or it may be a contributor to some sort of mental deficiency?
Well, we'll have to ask the president. I sometimes wonder, I wonder if he comes to the office in the morning and starts out that way. Because inevitably by the end of the day, somebody is angry. And I'm not sure he's depressed, but seriously, it could be, because some people, they don't want to admit to themselves that they're depressed because they feel it's a sign of weakness, you know? If they say, I feel sad, I feel angry, I'm in a do-nothing job, a go nowhere, I'm going to be doing this the rest of my life, and I hate what I do, but they're not able to verbalize those things, they take it out on other people. They may not even decide to do it that way, you know, when they get up in the morning, but somehow that's just their outlook. It's those dark glasses, you know, that they put on, and that's how they see the world, through those dark glasses. They don't see any sunshine coming in.
Okay, all right. Thank you.
You're welcome. Last chance. Anybody else have anything they'd like to ask me? Well, I hope you'll tune in next week when we talk about specific medications for depression. And I did, as you know, not speak a lot about bipolar today, because bipolar is a whole nother subject on its own, but it's certainly, depression is certainly half of bipolar, and we can address that at a later time. So I would like to thank you for listening today, and I hope that you will come back and listen next week to the part about medications. And I hope you have a good week. Thanks for listening.